You spoke a lot about chemotherapy and the different regimens, but it's really important that patients are also attuned to all their possible side effects. This is not only important so that we can help manage them in more of the immediate or short-term setting, but it's also critical because it helps prevent long-term events that may otherwise impair patients' quality of life. For this reason exactly, I have typed out some of the common side effects of these medications. As you can see, I organized it by column. I know this list may look overwhelming, but we're going to break it down into the individual chemotherapy medications and discuss in detail their side effect profiles. Before I jump into them individually, I just wanted to point out some commonalities. So all of these medications are to some degree going to result in myelosuppression, which is a drop in our blood counts. They may also cause nausea, vomiting, and diarrhea, but we do have very good medications that help patients with those symptoms. Now let's talk in specifics. So cisplatin. Short term, like I mentioned, we might see decrease in your cell counts, which is myelosuppression, nausea, vomiting, diarrhea, kidney injury, neurotoxicity, which manifests as neuropathy. So this is the numbness, tingling, sometimes pain that can occur in the fingers and toes, as well as ototoxicity, which manifests as high frequency hearing loss, sometimes tinnitus, and very rarely, but occasionally, deafness. The other real concern is the risk of secondary malignancies, and we're going to talk about that more in detail later. For etoposide, again, you're going to have the risk of a drop in your blood counts. This medication can cause hair loss, some same nausea and vomiting, mucositis, which is when you get like blisters or sores in your mouth. And again, the secondary hematologic malignancy, which is a blood cancer that can happen years later. Bleomycin. So this medication has some particular side effects that I would like to point out. In addition to hair, skin, nail changes, you can see vascular toxicity. And this generally manifests in something called Raynaud's, which is like a vasospasm in the small vessels in your fingers. It can also manifest as cardiovascular disease, arteritis. And one of the main long-term side effects that we're looking out for is pulmonary. So this can cause fibrosis and pneumonitis, but only in about 10% of cases.
And I would like to also mention here that for our patients, if the patients are above 50 to 55 years of age, or if they have significant injury to their lungs due to COPD, or if they have been smokers in the past, those patients we typically reserve not to use bleomycin given these risks. And this is something we always keep in our mind.
Ifosfamide. So again, cause drops in the cell count, hair loss, nausea, vomiting. This one uniquely has other CNS or central nervous system toxicities, which include confusion, hallucinations, blurred vision, and kidney injury. And the kidney injury is a big one we look out for. You may even require extra IV fluids to keep you hydrated. Again, this medication can cause secondary malignancies or cancers that occur later down the line.